We're now joined by Dr. David Perlin, who's Chief Scientific Officer, Senior Vice President of Hackensack Meridian Health, Center for Discovery and Innovation. Good to see you, David.
Good morning, Steve. Good to see you.
You were with us early on in the pandemic. We're taping this at the end of January 2022. Do you believe, from a scientific perspective, as much as you can know and the scientific community can know, will there be, quote, in your view, an end to COVID, or should we be talking about it differently?
I think we have to, I think for now we have to think about it a bit differently. We have to think about how do we adapt and how do we sort of resume our lives, knowing that the virus is there. There will be new variants, that's a given, but that we have mitigation strategies and we can really coexist with this virus, and that's where we have to get to. And we may ultimately get to the point where the virus evolves sufficiently where it's highly transmissible, but it's causing less severe disease, and therefore it becomes more cold-like, and that's how we've adapted to it.
Yeah. You know, a couple things. First, I want to disclose that I teach in the Hackensack Meridian Health Physician Leadership Academy, and I've gotten to know many of the physicians within the network, and we've talked about this extensively. But one of the things we do talk about in the Leadership Academy is communication. And I have to tell you, it's confusing, and it's turning into a leadership and communication case study, and I will not get on my soapbox here, David, but the CDC, the Centers for Disease Control, as we speak, at the end of January, it is fair to say that the messaging has been confusing around the science and if that is the primary source we should be following. Has that not been confusing, A, and B, does it have to be that confusing?
It certainly has been confusing and does not need to be confusing. But, you know, the CDC is very much focused on transmission and disease of severe disease that winds up filling our hospitals and causing morbidity and mortality, as we saw early in the pandemic. But we're at a state now where we have to really think about this disease and in sort of two ways. I mean, we have two very distinct populations. We have the unvaccinated, immunocompromised population, high risk of developing disease, hospitalization, potentially death. But this is the case for almost any highly infectious agent, whether it's influenza. We have high-risk populations. We recognize that. We have to address that high-risk population. Then we have those who are vaccinated, those with waning immunity, those who are boosted. They're at much lower risk of severe disease and morbidity and mortality. If we think about those two categories, then the CDC recommendations in terms of transmission and what we have to worry about, you have to understand where you fall. And once you do, then we can empower ourselves to employ disease risk mitigation strategies. First of all, get vaccinated. Wear a mask when you're in a situation where you're uncomfortable, and then fundamentally understand that if you do become ill and you're vaccinated, it is likely to be a very mild disease. If you're immunocompromised or unvaccinated and you become ill, it's potentially a more serious disease, but we have risk mitigation, meaning that we have antibodies, we have strategies to be able to deal with you. So the CDC is focused very much on transmission. And the problem, I believe, is that everyone believes that infection means disease, potential, high risk for hospitalization and mortality, and that's not the case today.
By the way, the Center for Discovery and Innovation, give me 30 seconds, give everyone 30 seconds on what it is and why it matters.
So the Center for Discovery and Innovation was created by Hackensack Meridian Health as a way to take high-end science and be able to take those innovations and move them rapidly into the clinic. And that's in the form of diagnostics, vaccines, therapeutics, changing standard of care. And so that's what we do.
Got it. And HMH is an underwriter of our healthcare programming, to disclose that. But quick follow-up on this. Discovery and innovation, science. Is it fair to say, because I was trying to understand the history of pandemics around the world and in our country 100 years ago plus, et cetera. Is it fair to say, Dr. Perlin, that And can you say sometimes, as a scientist in the scientific community, quote, we don't know. We don't know where this is going. Or is there a compelling pressure? Is there compelling pressure to have, you're smiling at me, to have answers, because we outside the scientific community are looking to science for the answers?
Well, the fundamental basis of science is we don't know. So as a scientist, we're asking questions that we can then test and then try to derive answers for. The reality is that when you're dealing with pandemics, when you're dealing with rapidly evolving viruses like this one, it's going to take different turns. And what you have to do is be able to adapt to that. So the answer is clearly, yes, we don't always know what the correct answer is, but what we have to do is look at the data and say, okay, here's what's going on. We now need to change. And so, unlike other professions where it's really important to be rock solid about how you approach, well, you know what? You may need to change your approach. And here's a real important fundamental in medicine. 5 years ago, the standard of care was different than it is today. And it was different 10 years ago. And 5 years from now, the standard of care, what we say is the gold standard, will also be different. So it's a moving target. So you have to evolve. And whether it's in the longer term for standard of care or short term, like in a pandemic where you're learning on the fly and you have to adapt your strategies for risk mitigation to help people get through it.
Real quick before I let you go, we end this program, Dr. Perlin, how optimistic are you about quote unquote therapeutics to treat COVID?
Oh, I'm very optimistic. I mean, we have two new FDA, EAU emergency use
as we speak right now. So go ahead.
Today we have two, but there are others in the pipeline, and there's now a new initiative to really up the number of antivirals that we have. And this is an important thing, that we put all our eggs in the vaccine basket. It was not the right thing to do. We needed to have more of an emphasis on therapeutics. And if you just look at influenza, we manage influenza through vaccines and through therapeutics. But there are diseases like hepatitis C, HIV, tuberculosis, which are only managed by drugs. So we need drugs in addition to vaccines, and then we need all the other risk mitigation strategies.
Dr. David Perlin, thank you so much. We're smarter just because we listen to you. Appreciate it. All the best, David.
All right, thanks, Steve.
I'm Steve Adubato. That's Dr. Perlin. Thanks so much for watching. We'll see you next time.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by Bank of America, Suez North America, Delta Dental of New Jersey, the Healthcare Foundation of New Jersey, the Northward Center, Johnson & Johnson, the New Jersey Education Association, NJM Insurance Group, and by the Port Authority of New York and New Jersey. Promotional support provided by bestofnj.com and by the New Jersey Business and Industry Association.
How do you create change? By cultivating hope. And we see that every day. In the eyes of our preschoolers, in the souls of the seniors in our Adult Day program, in the minds of the students at Robert Treat Academy, a national Blue Ribbon School of Excellence, in the passion of children in our Youth Leadership Development Program, in our commitment to connections at the Center for Autism, and in the heart of our community, the Northward Center, creating opportunities for equity, education, and growth.